Welcome everyone to today's webinar, How to Have Better Sex with Mindfulness. I'm Dr. Jeff Soloway. I'm the co-founder and chief training officer at MindWell-U. MindWell-U offers online and in-person evidence-based training in mindfulness for organizations and individuals. Today we're incredibly fortunate to have Dr. Lori Brotto to share with us her area of expertise and research around having better sex with mindfulness. And it's a topic that's gained a lot of interest. We've got a lot of people on the webinar today from coast to coast. So we're so happy that you can join us. And before we introduce Dr. Brotto, I want to just give you a few housekeeping items. One is that we are going to be sending around a link in the coming days with a recording of the webinar. So you'll be able to share this recording with your colleagues or friends. We are going to include a few polls in today's webinar. So if you see a poll, jump up onto your screen. It might look something like this type of a poll. Maybe you see this poll. So take just a moment to complete the poll, because it's interesting for us to get a little bit of feedback and to be able to get a sense of what you're thinking on a question. So this question: how many of you have participated in the 30-day mindfulness challenge? The 30-day mindfulness challenge is our core online training program at MindWell-U. Great to see a lot of you have done that. So we offer this program to organizations over an annual license. And so if you're joining us from one of those organizations, welcome. It's great that you've done the challenge. And if you have done the challenge, that you'll know that our core practice on the challenge that we teach is called Take 5. And Take 5 is a mini mindfulness in action practice, where we're really teaching you how to tune in throughout the day and make it a habit. And it's a very simple practice where we don't need to necessarily go into a quiet, dark room for 20 minutes and close our eyes in a cross-legged position. We can take 5 right now. And so I'll welcome you right now on our call to just feel your body sitting on your chair, your touch points with your feet or your shoes, perhaps your bum on the chair, or if you're standing, lucky you if you're standing. Lifting and lengthening up through the spine. So we're just feeling into our body. Noticing that the body is breathing. You might feel the breath rising in the belly or in the chest. So just feeling one breath moving in, one breath moving out. See if you can deepen and lengthen that breath. So the inhale and the exhale is about 5 seconds. So breathing in to a count of 5. And breathing out to a count of 5. And here's the challenge. See if you can take 5 breaths in this way. So the inhale and the exhale counting as 1. And don't worry if the mind wanders away. That's what minds do. Just come back to feel the breath moving in the body. Just preparing ourselves to be fully attentive and present for today's webinar, How to Have Better Sex with Mindfulness, with Dr. Lori Brotto. And so we need to bring ourselves fully present, leave all the things that we were doing before in the past, or everything in the future as we come here and now, and noticing what's present for you now, and seeing if you can just greet and relate whatever is present, whether it's easy to be with or difficult. See if you can greet that with a sense of non-judgment and patience and acceptance, so that we can come fully present. And bringing us now. So you'll have an opportunity to sign up for the 30-day challenge if you haven't done so, either through your organization, or you can sign up as an individual and take it as well. So we'd love for you to try that. Dr. Brotto is a professor in the Department of Obstetrics and Gynecology at the University of British Columbia. She's a registered psychologist, and she's also the executive director at the Women's Health Research Institute. She's just written a new book, How to Have Better Sex Through Mindfulness, published by Greystone Books, which is now available. It's a scientifically informed translation of her research on mindfulness to improve sexuality. And so that book is available on all your normal channels in Amazon or Chapters. And we've got this sneak peek into the book. So Lori, thank you so much for joining us today. It's really wonderful to have you here.
Thank you so much for having me here, Jeff.
Let's give the viewers a little bit of a background into your area of research. Please share with us.
So the bulk of my research over the last really 15 years or so has focused on sexual health, more specifically sexual concerns in women. And my interest in this area was really triggered after the approval of Viagra in 1998 in the United States, 1999 in Canada. And it was really a watershed moment for the field of sexology. Suddenly, men had a very accessible, a relatively safe, a very effective treatment to address the very common sexual concern of erectile dysfunction in men. And later that same year, there was a study that was published by the Journal of New England Medical Journal, and it found that about 40% of women over the course of a year reported experiencing significant sexual concerns. These were concerns that were chronic and lasting. And so what that told us is that, first of all, there were many more women compared to men who experienced sexual difficulties, that about 22% of women had at least two or possibly more sexual concerns, and that they were quite distressing for women in that they impacted women's quality of life, their mood, their relationships, their sense of self, their levels of stress and anxiety. And with the approval of Viagra, it really turned many researchers, myself included, into looking at what sorts of effective and available and safe treatment options are there for women. And that search for me ended fairly quickly in that there were no Health Canada nor FDA approved medications for women. And when we look at the literature on psychological interventions for women, it was also a fairly narrow literature base. So there was some evidence for cognitive behavioral interventions, but really it was a literature that was really quite sparse. So that really started me down this pathway of trying to investigate, first of all, what are the main causes of sexual concerns in women? And then secondly, once we've identified those causes, can we start to look at what might be the means of an effective intervention for addressing those common concerns in women?
Wow. Well, that's fascinating, Lori. So interesting to hear about the history and how it all started. And what about when did you first start to see the connection between mindfulness and sex, and kind of what got you interested in the area?
So this was around 2002, 2003. I was completing a psychology residency, followed by a postdoctoral fellowship at the University of Washington. And while I was there, I had an opportunity to train with Dr. Marsha Linehan, really a world-renowned leader in the area of managing out-of-control behaviors, parasuicidal tendencies. And Dr. Linehan had developed a treatment called dialectical behavior therapy, which had as one of its core ingredients mindfulness. And so over the course of the years that I was in Washington, I was introduced to mindfulness and learned and applied mindfulness to the patients that I was seeing who had active suicidal tendencies. And what I learned was that really the root of many of their concerns was this tendency to either be in the future, so to catastrophize and imagine that things were never going to get any better, or their tendency to ruminate and be in the past and relive all of their imagined past failures. And that by teaching them mindfulness, it was a very effective way for helping them to stay right there, to ride out the feelings of distress as if they were on a surfboard. And what I observed really firsthand, as well as my exposure to the literature, was that mindfulness was an incredibly powerful tool for helping these individuals be right there. And it was very, very effective for them in managing their suicidal inclinations. Now, at the same time, I was doing research, continuing to do research on sexuality and sexual concerns. And I was involved in some research at the Seattle Cancer Care Alliance, one of the biggest cancer centers in the United States, and working with women who had undergone fairly significant surgeries for their cervical cancer. And how the women described their concerns was in the sense of a complete loss of any feelings, no sense of pleasure, and a real disconnect from themselves as a result. And I saw some parallels between that group of women who had experienced these rather significant sexual difficulties with the women and the individuals that I was working with around their parasuicidal tendencies. So I sort of had this light bulb moment around, could we use the skills of mindfulness to teach these women post-surgery to tune in, to notice what's there, to be with whatever sensations were there? And could that be one way of helping them to reconnect? So that was really the start of pulling together the core elements of an intervention, a mindfulness-based intervention. In the early stages, it involved meeting with the cancer survivors once per month over 3 to 4 consecutive months, introducing them to mindfulness skills in my office, and then encouraging them to go home and practice the skills on their own on a daily basis. And to be honest, I didn't have really any expectations of where this was going to go. Had scoured the literature. No one had really used mindfulness for sexual concerns as far as I could see in the past. But lo and behold, when the women came back to my office and shared stories of feeling sensation for the first time in years, or noticing pleasure, or feeling arousal, and being filled with tears at noticing this arousal, it was certainly enough to convince me that there might be something in this connection of bringing mindfulness to sex that would be worth pursuing.
Well, that's really interesting, the journey. And when you were working back in Washington, working with Marsha Lindenham, I mean, she did a lot of work, and people there did a lot of work after DBT around mindfulness and relapse prevention. Yeah. And so interesting how that was also a starting point for you in your work around integrating mindfulness into sex. So really, that's really fascinating. And when you were starting to integrate it with patients, what were you teaching them? What were you learning about what was important to teach them?
So given that, and again, the first group of women that we had tried this with were women who had undergone a radical hysterectomy for cervical cancer, and their primary stories or concerns were really around not feeling sensation. So it became really important to root the exercise, the observation in what was happening in the body, and to observe what was happening in different parts of the body in a non-judgmental way. And we spent quite some time doing that because, of course, with the sense of loss of genital arousal, with the sense of loss of pleasure, came layers and layers of judgment. So the women judging themselves for having gotten cancer, judging their cancer team for carrying out a procedure that left them with such loss, maybe even judging their partners for wanting to continue to have sexual activity despite the women's significant distress. So there was a lot of judgment and shame that the women experienced alongside with their sexual difficulties. And so weaving in the practice of non-judgment, of compassionate awareness was really quite fundamental right from the get-go as I guided them through observing the different parts of their body. And through the course of doing our body scan, we spent quite a bit of time around observing pelvic and genital and vulvar sensations and lack of sensations, and noticing what that actually felt like to be with non-sensation as well. And so perhaps maybe unlike more traditional body scans that maybe sometimes jump from, the belly down to the thigh and might skip that all important area that includes the pelvis and the genitals, we actually spent quite a bit of time there.
And when you're talking about non-sensation, it's not uncommon in a body scan, body awareness practice, a mindfulness practice, to have the experience of non-sensation. And often part of the training in mindfulness is attuning our awareness. We're kind of like the subtleties of body awareness. That's the whole point of the training, is trying to feel into the body, and that our minds are just not tuned in to that level. And when we start to pay attention and practice, and it takes time to actually tune the mind into those sensations, then we can actually start to feel more. So at first we're like, what am I supposed to be feeling? There's nothing to feel. And then as we let the mind settle and we kind of learn to use it in this certain way, all of a sudden we start to tune into more of what's actually there.
Yeah, and that what you're describing was also really, really important with this first population of women that we worked with, because what they shared was that in observing non-sensation, it tended to take them down the storyline of loss again. So they would notice non-sensation and suddenly get wrapped up in a flurry of thoughts and worries and loss. And so how could they observe non-sensation, or the spaces between sensations, and stay there and observe these negative thoughts, catastrophic thoughts, worrisome thoughts as just passing events of the mind? And so that became really important as we moved along.
So I want to just broaden out our context for a moment, and then we can dive back in. And I'm curious to get your perspective on a couple things. First is, I'm curious around the relationship to men. So what are you learning around, what have you learned just in this conversation? How does this relate back to men? And then also, secondly, you've been talking a lot about clinical populations and some clinical populations. And are you finding, the relevance to non-clinical populations as well? Some of the things that you're learning, is it relevant to all the populations? And one more thing before I let you respond there, Laurie. I just wanted to just remind the audience out there that there's an opportunity to ask us questions. So if you have a question for Laurie that's arising, please don't hesitate to put it into your chat on the side, on the sidebar of the webinar, and I'll do my best to ask it either right now or where it fits most appropriately, or towards the end of the webinar. But please do post your questions for us. Thanks, Laurie.
Great. So I'll try and unpack those questions. The first question was around what about for men? And, as you alluded to, the book, Jeff, it has women in the title, How Women Can Cultivate Sexual Desire. But of course, I've been very interested in the applications of mindfulness for men as well, because as you'll remember from one of the earlier slides that you showed, sexual concerns are also quite common in men. And in fact, low desire or loss of sexual desire is the most common sexual difficulty in men. And it's not specific to any particular age group or demographic. It tends to happen across ages. And certainly in my clinical practice, I see quite a number of young men who report this concern around loss of desire, or might have performance anxiety, feeling like they need to maintain a certain standard or ideal that society sets for them, or perhaps something or someone else sets for them. So mindfulness, in the same way that it has, we've been using it with women as a way of practicing compassion, as a way of tuning in, as a way of noticing that sort of brain-body connection, which is so critical for sexual response to unfold, is also very, very effective for men. So in my clinical practice, most certainly I've been using mindfulness, whether it's with men with a loss of sexual desire or men who have premature ejaculation. So they might start to catastrophize about the outcome or worry about the outcome. And that sets in this surge of sympathetic nervous system activity that might then lead them to ejaculate before they wish to. Or the sample of men who have erectile difficulties. So men who maybe have no difficulties getting an erection on their own, but then with a partner, when anxiety sets in, suddenly they have difficulties either getting an erection or keeping an erection. So with those different groups of men, we, over the last 2 years or so, have started to investigate this empirically as well. And our preliminary data are not at all surprising, certainly very, very promising, in that some of the same findings that we're observing with women are happening with men as well. One of the groups of men that we're now sort of turning our sights on are prostate cancer survivors. And these are individuals who, despite the very, very excellent success rates of the surgical treatments and chemotherapy and radiation treatments for prostate cancer, they do leave quite a significant number of men. In fact, the data show us most men following prostate cancer will have some degree of erectile dysfunction. And they, to a certain extent, need to learn to live with that. So our current research study involves recruiting prostate cancer survivors together with their partners and exploring how mindfulness can be a vehicle for teaching men how to tune into sensations, even in the absence of an erection, and also a way of compassionately broadening the sexual repertoire. So besides kind of conventional sexual intercourse, what are some of the other ways that one can continue to be sexual and feel pleasure? So we've had some quite promising initial findings in using mindfulness with that group of men and their partners. Sorry, Jeff, I'll hear your response to that before I jump to your second question that was embedded.
Thank you so much for such a comprehensive response. I think it's really interesting for our viewers to hear that. One question that pops up for me is around motivation. Are you finding, like, with mindfulness, there's a lot of evidence to show the benefits. Are you finding people are coming? Are they motivated to do the practice and engage in the training or the treatment? I guess it depends. What have you learned about the best way of framing this?
Yeah, it's such an important question because if we find through our research that yes, mindfulness is effective, but it's only effective for those individuals who can commit the full 8 weeks, who are highly engaged and motivated at the beginning, and who have a high degree of confidence that this is going to be applicable and useful for them, then that's a very different picture or story than concluding that mindfulness might be something that is kind of more universally useful for people. So we've actually looked at that question in our research. One of the ways that we've looked at that question in one of our recent 5-year studies looking at mindfulness for women with low desire is after the first session, so the first of 8 sessions of mindfulness, women were sent a question anonymously, and they were asked, based on what this first session and based on this kind of preliminary presentation and understanding of mindfulness, to what degree do you think that this is going to help in addressing your sexual concerns? And what we found was that women's response to that question had actually no bearing whatsoever on the outcome. In other words, the women that had a low degree of confidence that this was going to be useful for them had an improvement in sexual function and desire to the same degree as those women who were highly invested and had a high degree of confidence in the treatment. So that was actually quite reassuring for us in that their level of kind of belief that this might be applicable and useful for them really had no bearing on predicting whether it was indeed useful for looking at sexual desires specifically. Now, your other, I think, important part of the question is about motivation. And indeed, we let the women know before they even come to the group that, this is 8 weeks, that in addition to attending the in-person session, there's going to be some homework in between the weeks. We don't tell them quite how much before they arrive. And that has resulted in some loss of participants. Not a significant amount. It's resulted in less than 10% of women going on to then completing the 8 sessions. But something really remarkable happens in that first session. And our first introduction to mindfulness is, perhaps like many, many other mindfulness groups, is with an eating meditation. So using the raisin. And when we introduce the raisin, we don't let women know what we're about to do. We don't let them know that mindfulness is a tool for helping them address their sexual concerns or cultivating desire, but rather we dive right into the practice. And so over the course of about 10 or 15 minutes, guiding them through noticing the raisin, listening to it, smelling it, putting it in their mouth, slowly chewing, observing the burst of flavor. Afterwards, we then engage in a discussion around, what did you notice? How is that different from how you normally eat a raisin? And importantly, do you think that this is relevant in some way to your sexual concern? And the response to that third question is quite profound. Suddenly, women fully appreciate on their own, oh my gosh, if I can cultivate my attention and pay attention to the raisin and take that and apply it to sex, wow, I wouldn't have any sexual concerns. Or if I could observe the sensations during feeling desire or during sex in the same way that I observed the burst of flavor in the raisin, imagine how incredible sex would be. So they make those connections on their own. And I think it's really critical for their motivation that they come to those observations on their own, that it's not myself or another facilitator telling them what to expect.
Right. It's through learning through experience, which is
Right.
which is key. And it's I guess I know that there's probably a lot of people out there, maybe in non-clinical groups, wondering about the benefits. And I mean, we've had this conversation a little bit, and the work of MindWell-U is all about trying to get mindfulness out and make it more relevant and accessible, and for within organizations and for busy working professionals. And we've actually worked with men. We designed our training program with men in mind when we first started out in affiliation with the Movember Foundation. And I know they've got a big research background around prostate cancer as well. But just recognizing that the challenges of engaging and motivating men and women to, when they're busy, to engage in these types of practices, it takes quite a bit to just get them in the door and even into the same room for 8 weeks sometimes. So we've had some preliminary conversations about the possibility of kind of collaborating on some future research, and I think that sounds really interesting to see about how could an adapted version of the mindfulness challenge be used with these populations.
Yeah, I think it's a very logical next step in looking at this work. The bulk of my work until now has really focused on mostly clinical populations, or people who are seeking treatment for distressing concerns. Yet we know that sexuality can impact most individuals in some sense, right? So your sense of self as a sexual person, as a sexual being, perhaps fleeting sexual difficulties. So one need not have a diagnosed medical condition in order for this topic to be relevant and meaningful for them. And so the possibility of looking at an adapted version that one can do online, like MindWell-U, or on an app, I think is a very important next step in this work.
Oh, great. Thanks for kind of zooming us out a bit. And now I think likely a good opportunity to zoom back in and hear a little bit more about mindfulness and how does it improve desire and arousal, satisfaction inside and outside of the bedroom.
Yeah, so if we look at those individuals who will report either a loss of sexual desire or absent sexual desire altogether, their complaints tend to center around, I don't feel interested in sex anymore. I never think about it anymore. I don't initiate any kind of sexual activity, nor respond to a partner's invitations to sexual activity. And there's a real reduction in the sense of kind of pleasure during touch, during sexual activity. So that kind of constellation of symptoms has been primarily, but what we've been focusing on in our work with low sexual desire. And so the question has been, to what extent can either a 4-session mindfulness intervention, or much more recently, an 8-week intervention, address those different facets of sexual desire. And importantly, it's not just the loss of sexual desire, but it's the co-occurring distress, right? So it's the fact that one notices a change from before, and it significantly bothers them. It interferes in their life, in their relationships, in their sense of self. So that's been a second major focus of our work, is to what extent can this type of intervention reduce distress. And I'll ask you to just pull up a slide showing that, Jeff. And so the slide is going to depict, I believe it's going to be the one after that. Let's see, there we go. So what we see, and this was in a group of women with low sexual desire and associated distress, with the primary kind of focus being desire. And you can see that not only was there quite a significant increase using this validated measure of sexual desire, but the D, which tells us what's the kind of magnitude of that change along the bottom. So a D of 0.9 tells us that this is a very, very meaningful, clinically meaningful improvement. Usually anything above a 0.5 indicates at least a moderate or very strong response. Really across the different samples of women that we've done this with, whether it's women primarily with a concern of low desire, or the cancer survivors reporting pain and loss of arousal, or in our work with women who have had a history of sexual abuse and now want to engage in consensual sexual activity, yet might be experiencing either a recurrence of nightmares and flashbacks and being triggered, and have therefore a reduction in desire. So we're kind of seeing this very consistent pattern across the different populations of women, in that participation in the mindfulness results in this improvement in desire. We also see, if you look at those middle two bars, when we look at kind of global sexual function, so this would include physical sexual arousal, it would include intensity and frequency of orgasm, and it would include also the individual's sense of sexual satisfaction. So it's kind of a global measure of overall sexual function. And there again, we see significant improvement from before to after mindfulness, and the magnitude of that change is really quite clinically meaningful, very significant. And then the last set of bars tells us the extent to which their level of distress or bother comes down as a result of practicing mindfulness. And I really think that this last metric is kind of how mindfulness works, right? So by tuning into sensations, by noticing the mental chatter and the cascade of thoughts, and letting them drift by within the bigger kind of landscape, women first and foremost are becoming less distressed. And so my thinking is that probably through reducing distress, that might be one of the catalysts to then allowing them to feel more desire and have an overall stronger sexual function. So I'm quite reassured by these findings, because we've now kind of replicated this across quite a number of studies. And even when we bring women back into our research center a year later and they tell us, yes, I'm still practicing the mindfulness, yes, I'm still observing these benefits.
Well, thanks for sharing that evidence there, and it makes a lot of sense that if you're experiencing distress, it's pretty difficult to experience pleasure at the same time. And in a lot of ways, I think we start to see that's what the underlying function of mindfulness, taking us out of that the amygdala and that stressed brain, and bringing us out of that network, that neural network, and helping us to access other places. So makes a lot of sense.
Yeah. And the kind of next direction of our research will be to actually look at the brain and see what's happening in those emotion centers. Is what you're describing actually happening? And I agree with you. I think that's one of the core mechanisms for why mindfulness is so useful, so applicable to sex.
Well, that's great. Was there another? I kind of quickly went past a couple slides there, but
Okay.
I think you had mentioned.
Yeah, let's talk about this one a second, because this has been something that we added into our mindfulness intervention as a result of the women saying to us, okay, this is fantastic. I have this solid on the pillow practice. I'm bringing mindfulness also into different parts of my life. How do I actually take this now and bring it to sexuality? And so one of the exercises that we've developed, again, with several of our participants' input, is something we describe as sexual sensations awareness. And so after women have developed a fairly solid practice in the body scan, we then do an exercise where we pair the body scan together with an exercise that's designed to elicit sexual pleasure and sexual response. So one example is we might invite women to engage in a sexual fantasy, or invite her to read some erotic literature that's pleasing to her. And what either the fantasy or the erotica would do is it would stimulate, it would trigger some of those sexual arousal sensations in the body. And then we invite the women, after about 5 or so minutes of engaging in either the fantasy or the erotic literature, put that down, put it away, and then engage in a body scan. And let's observe what you notice in this sort of heightened sexual state. Are you tuning into perhaps sexual sensations that you don't otherwise notice during a regular body scan, or perhaps don't notice during sexual activity? So this has been a really powerful addition in our 8-week group. And in fact, what we've done is we've taken just this one exercise, the sexual sensations exercise, and tested it on its own. So in a separate lab-based study where we brought women in, and again did this pairing of a sexually evocative tool together with a body scan afterwards, and we essentially replicated that same effect. So much more tuning in and observing of sensations than otherwise women were experiencing. So that's been I think what maybe sets this particular adaptation of mindfulness for sex up somewhat apart from more traditional mindfulness-based stress reduction or mindfulness-based cognitive therapy kinds of body scans.
Right. Thanks for that distinction. Very interesting. We did have a question from someone in our audience about a group. Was there an age group? And I think you did point to it, that it was across, but I just wanted to come back to it. Is there a particular age group of women that you've seen this be most effective with?
So we have only done this with adults. So and it's because our research involves sexuality, and so the legal the sort of age of consent within the sexuality studies that we do is 19, but we've never had an upper age limit. And over the 15 years or so, we have looked at that question in a variety of different ways. So what impact does age have on response to mindfulness? And very reassuringly, no effect. Absolutely no effect of age on the findings at all. So regardless of women's age, and in addition, regardless of what stage of, whether they were pre-menopausal, perimenopausal, or postmenopausal, there were no differences in response to the mindfulness intervention based on hormonal status or on age.
Did we lose you there for a sec, your volume?
No. Can you hear me? Yeah.
Yeah.
Okay. So hopefully you got the bottom line. Yeah. No effect of age, no effect of menopausal status on the findings.
Thank you. Thank you. And we did ask a poll question there about how many people would be willing to use mindfulness during sex. And we had overwhelming, over 100%. I'm not sure how that worked out, but I think everyone was open to it. And so that kind of leads us into a next question is, what are some easy and effective mindfulness exercises that increase desire and sexual enjoyment? So what can people take away, both maybe clinical but non-clinical populations?
Yeah. So, first and foremost, and I think, Jeff, you would agree with me on this, that, mindfulness is an incredibly powerful tool. It's also a way of being. And so for any listeners who maybe have not tried mindfulness, learned the practice or the skill of mindfulness, that's often where I encourage people to start, is download an app, do the MindWell-U 30-day challenge, attend a mindfulness group at a community center. And so starting to adopt a practice, a very regular practice of mindfulness. And then once the practice is in place, there's a variety of different ways that we can start to then bring that to sexuality. So one of the ways that I often find to be quite powerful with couples, and I'll say more about in the non-couple context in just a second, but let's talk about couples for just a moment, is often there can be a sense of pressure to move on quickly to the goal, and for a lot of people that goal might be sexual intercourse, whether it's in a heterosexual or non-heterosexual context. But we know that there's so many different ways of touching and experiencing sensation that can be just as powerful, just as pleasurable, maybe even more so than sexual intercourse. So perhaps suggesting to a partner that rather than engaging in sexual activity, we're actually going to engage in sensual touching for 30 minutes. So instead of sex, we're going to touch one another. I'm going to touch you first. And for the 15 or so minutes that I'm touching you head to toe, I would invite you to tune in and just notice the sensations. What does that feel like? And maybe even notice if there's a tendency to want to move on quickly to intercourse, and just observe that as a tendency of the mind, and bring yourself back to sensation. And then after 15 minutes, you switch. So the person who was touched now does the touching, and the invitation is the same. Observe the sensations, notice what happens, notice if there are any urges or a wish to move on, and keep redirecting the mind back to the sensation. So this practice that I've just described is actually a very old practice. It was developed by Masters and Johnson in the 1950s, but we've really kind of spun it through a bit more of a mindfulness lens, that the invitation here is really to notice all the constellation of sensations that come up. This exercise is not intended to create arousal, create orgasm. It's not foreplay. Rather, it's a mindfulness exercise that brings two people and a couple together in the moment. So wildly powerful exercise that I use quite a bit with the couples that I see. I'll describe a different exercise that doesn't rely on a partner, and that might be in a bath or in a shower. Mindfully having a bath or mindfully having a shower, and then progressively in that bath or shower, also including some self-touch at the same time. So sort of head to toe, including genital touch. And again, as I've described the other exercise, not for the purposes of creating arousal or orgasm, but rather for the purpose of really feeling what does the sensation feel like, and noticing if there is arousal. And if so, how do you experience that? Where in the body do you feel that? Do the sensations come and go? So that also is an exercise that we include in our 8-week group, and it's also described in the book.
So here's thank you for such practical tips. I'm sure everyone on the call is just really appreciating that, how practical you've just described it. And I think it's fascinating how you said that first one, the first exercise, was developed in the 1950s, and yet it sounds, maybe just the way you described it, it sounds just like a mindfulness practice. So
sure does, yeah. But it was never described as such.
Right. We did ask a poll question: does mindfulness only work if a partner is also practicing? More people thought no. It doesn't require the partner.
Good answer. Yeah, absolutely. And so in our research, until very recently, and I've described the work we're doing now with prostate cancer survivors and their partner, but before this study, all of the mindfulness groups and research we've done have focused on individuals, not on partners. And that was actually a question that we asked our participants was, number one, does your partner know that you're here doing these mindfulness practices as a way of cultivating desire or putting you more in tune with sexual response? And for many of for a proportion of the women, they told us that their partners didn't even know. And then of course there was a separate group of women who had partners who were well aware, were very engaged. And that was something we actually found no difference on. So regardless of partners' involvement, the women continued to kind of glean the benefits on their own. Of course, for some of the exercises like the one I just described, it really requires that both individuals in the partner understand the instructions and participate. But that's just one example. There's lots of other examples that we've used and that are provided in the book where it really doesn't require that the other individual have an active practice on their own. But that might be something for us to study in the future, which is, when both members of a couple are actively have their own practice, what does their sexuality look like? Does it look different from those couples where only one has a practice or neither do? So you've just given me an idea for a future study.
And it probably also makes sense that just the sensitivity of what the other person might be going through, not physical sensitivity, but more emotional sensitivity, having the partner on board and just understanding a little bit more about what the partner is experiencing or not experiencing, and relating to that. Because part of the insight around mindfulness and body awareness is how unaware we are, how mindless we are, and whether you're experiencing sexual sensations or not, we all get aha moments around how little we experience or how much more we can experience.
Right.
And so
precisely.
developing that understanding, more emotional understanding about what the other person might be experiencing, and that can bring people together as well.
Yeah, absolutely.
We have just under 10 minutes, so I want to welcome anybody listening. If you do have a question, now's a good time to put it in so we can bring it forward. And I'm going to just bring us to a slide. We've jumped forward to a couple slides here, but have we touched on this one already, Lori?
No, we haven't. And thanks for bringing that up, Jeff. So, one of the questions that I've been really kind of preoccupied with in recent years relates to how does this work? How does paying attention non-judgmentally, moment by moment, how does that translate into improvements in desire, given that so much of the kind of biomedical and pharmaceutical research is looking at the combinations and constellations of different neurotransmitters and hormones in the brain that control sexual desire. So this is something I've been really focused on most recently in our research. And so what I have on the slide here are some of the possible mechanisms by which mindfulness might be improving sexuality. And one is that, well, maybe it's a mood enhancer. So we know that with sexual difficulties and dysfunction, particularly low desire, that it can often go along with low mood or symptoms of depression. And so maybe it is just that mindfulness is lifting mood, and is that one mechanism by which it's cultivating desire. So we've had some evidence for that in our research, but we've also found that's not the only route that of action there. We also have found that mindfulness increases our interoceptive awareness. And essentially what this is all of us possess a certain level of awareness of what's happening in our body, right? So there might be some of your listeners who are quite attuned to changes in heart rate or changes in blood pressure. Some women can feel when they ovulate. And so in our research, what we've found is that mindfulness increases this level of awareness of kind of general body sensations. And so maybe it is that by increasing general body awareness, that they're more attuned to increases in sexual response and sexual arousal. We also know that sexual difficulties tend to be associated with higher levels of anxiety and stress and worrying and catastrophizing, and mindfulness in our work, as well as in much of the other fields of research, have found that mindfulness can be quite an effective tool for reducing self-reported stress as well as anxiety. And so maybe that's one of the ways that it's useful with sexual response. We've talked quite a bit about self-compassion and how important that is, in particular with sexual concerns, where people can be very, very hard on themselves, feeling like they're not living up to society standards of what it is to be a sexual person. And finally, we're frankly distracted, right? We live in a distracted society. We're constantly pulled in different directions, and that doesn't stop during sexual activity. So our tendency to multitask and be pulled here and there in life in general continues within the sexual context. And so perhaps it's the case that mindfulness is reducing that tendency, or when we do get distracted during sexual activity, we're able to bring ourselves back to the present moment more often and more effectively. So these are probably some of the main ways that we've found that mindfulness is helpful for improving sexual desire.
Well, they all make a lot of sense, Lori. Thank you.
Good. And I'm glad the science supports that too. It's always helpful when science supports intuition.
Yeah, it's just fascinating to see the integration of mindfulness into these different areas. And you can see similar threads, how it's been incorporated into education or other clinical populations, mental health, and then now you see it into sexual desire. And I just find it fascinating how mindfulness, I like to talk about it as a core competency, and this really basic mechanism that's really going to support so many different areas of our lives. Mm-hmm. And that's why I like to talk about it like a literacy. It's this new literacy that we're developing, and they're teaching it in schools, and K to 12 schools now. It's part of the curriculum, and it's not so different than interoceptive awareness, and like body awareness is just something that we need to learn how to bring our mind back from wandering attention. Is just something that we need to learn how to do. And if we never were told about that, then we wouldn't even recognize it to be true. So it's just the skill. It's like learning to read. It's learning to do math. And so I think that, it's fascinating in that sense. A couple questions we have. What's the best way to introduce mindfulness to your sexual partner?
Yeah. So one way is you can say, guess what, honey? I listened to this really interesting webinar today, and did you know that there's this whole body of science looking at this tool, which has been around for a very, very long time. And it's been found to be quite powerful for sexuality. You want to hear about it. So that's one way. And in fact, I often tell the women in our groups who have not told their partners that they're participating in the group. The other way is through, just real practical examples. So noticing maybe your own tendency to be very distracted, and maybe a partner might also say, oh, I'm pulled in so many different directions, and then introducing it that way as a way to really kind of head on grapple with that very real, very almost, it's becoming almost natural, although it's totally unnatural, tendency to get distracted. So I think raising it in an honest, in an authentic way, perhaps not as a way to fix something that's broken, but maybe as a way to augment something that's already great between the two of you. And of course, the extent to which you can refer to the science that's provided quite a compelling story for how this works, not only in the short term, but also over the long term.
We often see on the 30-day mindfulness challenge, you're allowed to invite a buddy. And we often see people wanting to invite their spouse as their buddy on the challenge. And sometimes that's a good idea. Sometimes we want them to do it, but they need to be ready for it. But sometimes learning together, right? Like an example like that, where you can go through a training and you're going through it and then invite somebody else and to go through it together. That's often a helpful way to.
Yeah, and I've got a few other examples of those in the book that are maybe less intimate as a way of putting a toe in the water, so to speak. So I describe an exercise where the two members of the couple are standing back to back, and you can essentially do a body scan that includes those points of contact between your back and your partner's back. And because you're not looking into one another's eyes, it's perhaps a little bit less vulnerable than when you're staring at each other into each other's eyes.
Mm-hmm. And we did have another question from someone in the audience about other tips, exercises for couples who want to increase their sex mindfulness at higher levels, and maybe due to time. And it's a good reference to check out your book because it sounds like you do give a lot of practical tips in the book. Maybe, I don't know if it's a quick answer, but I'd like to see your response. We had a question about how do you work on mindfulness and good sexual health during a stressful time and when someone's coming out of depression.
Yeah. So, I mentioned earlier that often depression and sexual difficulties can go hand in hand. And sometimes a depression can actually trigger a sexual difficulty, or vice versa. If someone has ongoing sexual difficulties, it can trigger a depression. So because so much of the practice in mindfulness is about compassion and about being right where you are, and about letting go of expectations. And sometimes with depression, there's a real apathy around sexual activity, and that's okay. It's okay to go through phases where sexuality is not prioritized, where it's not working well, where pleasure is not where it was before. And so it's really, again, I think the compassion aspect of the practice of mindfulness that helps one to still feel connected and still feel in tune without necessarily engaging in the satisfying sexual activity that they might return to at some point in the future.
Thank you, Lori. Appreciate that response. And I'm gonna just close off now, and then I'll come back to you for any last comment. And so I want to thank everyone for joining us today for this really insightful webinar. I thought it's been an amazing conversation with Dr. Lori Brotto, learning more about how to have better sex with mindfulness. So practical, evidence-based, and some amazing tips. And we're going to be passing along a recording of this session in the coming few days. So you'll be able to review that again, look at some of the tips again, share it with other people. And maybe that's a good tip for you. Might want to share this with your colleague, your sexual partner, if that was a strategy that you wanted to learn more about. And you'll also have an opportunity, if you haven't taken the 30-day mindfulness challenge, that's an easy, quick way to learn more about mindfulness and start to integrate it into your life and to develop this new practice on Take 5, and integrative practice that can really come into your daily life. One last thing is we do have a upcoming another webinar coming up next month in July with Hirsch Foreman, who's going to be talking about how mindfulness can boost your performance, and more in the context of the workplace organization. So there's more information on how you can sign up for that. We really appreciate you taking the time out of your day to learn with us today. And once again, to Lori for taking the time to share with us her expertise. Thank you so much, Lori. It's been really insightful. And any last words for our audience?
Yeah, thanks so much, Jeff, for the opportunity. You know, although the focus has been on mindfulness, the focus has also been on sexuality, and it's not an easy topic. It's a topic that can garner quite a lot of an embarrassment and shame, and so know that this is one tool that can help put you back in touch with that satisfying sexuality that you had in the past, or that you can be experiencing in the future. So just want to acknowledge the courage that it takes to acknowledge and honor that part of yourself.
Thanks so much, Lori. Thank you, everybody. Have a wonderful rest of the day.
Thanks. Bye.